Life by Dr. Pat. Leading innovation in fertility excellence.
Deep dive into reproduction with Life by Dr. Pat.
3D pelvic ultrasound should be investigation of choice in women with infertility.
All right, so welcome back for another deep dive. Today, we are going to be looking at 3D ultrasound.
Okay.
And its role in fertility evaluations.
Interesting.
We're going to be looking at a pamphlet from a Thai fertility clinic. It's called Life by Dr. Pat.
Oh.
And they really advocate for using 3D transvaginal ultrasound. So 3D TVUS.
Yeah.
For like those initial infertility assessments.
It's pretty interesting how they're presenting this technology.
Yeah.
Almost like it's a must-have for anyone starting their fertility journey.
Right. Like, why is this so important?
Yeah.
So we're on a mission to understand why this clinic is so gung-ho about 3D TVUS.
Yeah.
What's all the hype about? And what are the potential, pros and cons based on what this pamphlet tells us?
Yeah. Well, I think to understand the significance of 3D TVUS, we need to first grasp the complexities of infertility itself.
Yeah.
You see, almost half of all infertility cases are due to issues with the uterus or fallopian tubes.
I knew it was a common problem, but I didn't realize it was that prevalent.
It really highlights the importance of pinpointing the exact cause, which can then lead to a more effective treatment strategy.
Right.
This pamphlet actually lists a variety of potential causes for female infertility.
Yeah.
We're talking everything from ovulation problems and hormonal imbalances to abnormalities in the uterus and blockages in the fallopian tubes.
Sounds like there's a lot to consider.
Absolutely. And traditionally, the gold standard for evaluating these issues has been a combination of laparoscopy and hysteroscopy.
Can you break those down for us?
Sure.
I'm sure many of our listeners like me aren't medical professionals.
Of course. Laparoscopy is a surgical procedure.
Oh, okay.
They insert a thin instrument, almost like a tiny telescope,
Yeah.
through a small incision in your abdomen to view your pelvic organs.
Oh, wow.
Hysteroscopy involves a similar instrument inserted through the vagina and cervix
Okay.
to view the inside of the uterus.
So both offer a direct visual.
Exactly.
But I imagine there are downsides, especially with laparoscopy being surgery.
You're right.
Yeah.
Laparoscopy, while effective, is invasive.
Yeah.
It requires anesthesia and recovery time.
Right.
Not to mention the potential cost,
Oh, yeah.
which can be significant.
That sounds pretty intense.
Exactly. And this is where 3D TVUS enters the scene
Okay.
as a possible alternative.
Okay. Now, I'm curious. How is this 3D TVUS different from a traditional 2D ultrasound?
Imagine 2D ultrasound is giving you flat images,
Okay.
kind of like slices of bread.
Okay.
3D TVUS takes those slices and stacks them together
Gotcha.
to create a whole loaf,
Okay.
a full volumetric image.
No. Okay.
It's similar to CT scans or MRIs,
Wow.
but it uses sound waves instead of radiation.
So you get a more complete picture instead of just...
Precisely. And this pamphlet really emphasizes the advantages of this complete picture. They claim that 3D TVUS is incredibly accurate and provides a detailed evaluation of both the uterine cavity and the fallopian tubes.
Wow.
And the best part? It's non-invasive.
Oh, wow.
No incisions, no anesthesia, no lengthy recovery.
That has to be a relief for anyone facing these evaluations.
And it's interesting how much they emphasize the ability to thoroughly evaluate the fallopian tubes.
Why the focus on the fallopian tubes?
Because they are absolutely crucial for natural conception.
Yeah.
They act as pathways for the egg to travel from the ovaries to the uterus.
Right.
Any blockage or damage can significantly affect a woman's chances of conceiving naturally.
Makes sense. I bet it also affects IVF success rates.
You're absolutely right.
Yeah.
The pamphlet specifically mentions a condition called hydrosalpinx,
Okay.
which is when the fallopian tubes are blocked and filled with fluid.
Hydrosalpinx.
Yeah.
That sounds serious.
It can be. Hydrosalpinx can drastically reduce IVF success rates and often requires surgery to remove the affected tubes before starting IVF.
So if 3D TVUS can accurately diagnose hydrosalpinx, it could potentially prevent unnecessary IVF cycles or even surgeries.
Exactly. That's a major benefit they highlight.
Yeah.
They also point out that 3D TVUS isn't just limited to fallopian tubes.
Oh, okay.
It can also detect abnormalities in the uterus itself,
Interesting.
like polyps, fibroids, or a septum,
Okay.
which is a wall or partition within the uterus.
Gotcha.
These abnormalities can also contribute to infertility.
So it's like getting a thorough check of the entire reproductive system all at once.
Precisely. It's important to remember that there are other ways to assess fallopian tube health.
Right.
And this pamphlet actually compares 3D TVUS
Oh,
to a couple of those methods.
Okay.
High CoT-FIN and HSG.
so how does 3D TVUS stack up against these other tests?
Each method has its own pros and cons. Like
Yeah.
HSG, for example, is a well-established method
Okay.
using X-rays.
Right.
It's widely available.
Yeah.
But it does expose you to radiation.
Yeah. That's not ideal.
And it might not be as accurate as ultrasound-based methods.
Okay.
High CoT,
Yeah.
like 3D TVUS, is non-invasive.
Okay.
But 3D TVUS seems to offer more detailed information about both the fallopian tubes and the uterine cavity.
It sounds like they're presenting 3D TVUS as the most comprehensive and least invasive option.
That's their main argument, yes. However, it's crucial to remember that this is promotional material
Yeah.
from a clinic offering 3D TVUS.
Right. Of course.
It's in their best interest to showcase the advantages.
Good point. Are there any limitations or things we should keep in mind
Absolutely.
when evaluating their claims?
Even with advanced technology, interpreting the images still depends heavily
Right.
on the skill and experience of the physician
Okay.
performing the ultrasound.
Yeah.
And while this pamphlet might make 3D TVUS seem like it's everywhere,
Yeah.
access to this technology
Right.
could vary
Of course.
depending on your location
Yeah.
and healthcare infrastructure.
So, like with any new technology, widespread adoption takes time.
Exactly. And I also want to mention that they do cite a few research references
Oh, perfect.
in this pamphlet.
Yeah.
These could be valuable resources for anyone wanting to delve deeper
Yeah.
into the scientific evidence supporting the use of 3D TVUS in infertility evaluations.
That's great. We'll definitely include those references in the show notes for our listeners.
Perfect. They actually provided two references.
Oh, okay.
One is a 2022 article from Fertility and Sterility
Okay.
titled Modern Assessment of the Uterine Cavity and Fallopian Tubes in the Era of High-Efficacy Assisted Reproductive Technology.
Wow, that's a mouthful.
Yeah, it's a long one.
Okay.
It looks like it offers a broad overview
Okay.
of different diagnostic methods, including 3D TVUS
Okay.
and their roles in the context of modern fertility treatments.
So it could give us a better understanding of
encouraging.
where 3D TVUS fits into the larger picture of
Yeah.
infertility evaluation and treatment. What about the other reference?
The second one is a 2022 article from the Journal of Clinical Medicine
Okay.
titled Diagnosis of Congenital Uterine Abnormalities, Practical Considerations.
Okay.
This one seems to focus specifically on diagnosing uterine abnormalities,
Great.
likely exploring the role of 3D TVUS in that area.
Which makes sense.
Yeah.
Since the pamphlet did highlight the technology's ability to detect both fallopian tube issues and uterine abnormalities.
Yes, they seem to be emphasizing the versatility
Yeah.
of 3D TVUS, presenting it as a tool
Right.
to thoroughly evaluate the entire uterine environment.
It's starting to become clear why they're so enthusiastic about this technology.
Yeah.
If it can provide more accurate diagnoses,
Right.
make the process less invasive,
Exactly.
and ultimately reduce stress for patients, it could be a real game changer.
That's definitely the message they're sending.
Yeah.
They even included visuals in the pamphlet,
Oh, cool.
comparing traditional 2D TVUS images
Okay.
with those from 3D TVUS. The goal is to show how 3D imaging allows for a more comprehensive and detailed view of the uterus.
Visual aids are always helpful,
Absolutely.
especially when you're dealing with complex anatomical structures.
For sure.
It makes it easier to grasp the differences between the technologies.
They actually use a clever analogy.
Okay.
Comparing a 2D image of the uterus
Okay.
to seeing only one side of a spinning top.
Okay.
Then they show how 3D imaging allows you to see the entire top,
Oh, okay.
capturing its full shape and dimensions.
That's a great way to illustrate the limitations of 2D.
Yeah.
And the advantages of 3D.
Exactly.
It's like the difference between a flat photograph of a mountain versus a 3D model you can rotate and explore from all angles.
Exactly. And that's what makes 3D TVUS so exciting.
Yeah.
It offers a more complete and nuanced understanding of the uterus and fallopian tubes,
Right.
potentially leading to more accurate diagnoses.
Yeah.
And as a result, more effective treatment plans.
It feels like we're witnessing a potential revolution in infertility evaluations.
It's definitely a possibility.
Yeah.
However, as with any new technology,
Right.
it's essential to approach it with a healthy dose of critical thinking.
Of course. Yeah.
We need to consider both the potential benefits and the limitations.
Yeah.
We need to carefully evaluate the evidence and avoid jumping to conclusions based solely on promotional material.
That's an important reminder.
Yeah.
This pamphlet offers valuable insights.
Yes.
But it's just one piece of the puzzle.
Right.
Further research and data from real-world applications will ultimately determine the true impact of 3D TVUS in this field.
You're absolutely right. That's what makes this deep dive so intriguing.
Yeah.
We're exploring a cutting-edge technology with the potential to reshape how we approach infertility diagnosis and treatment.
Yeah.
It's a journey of discovery, and we're learning right alongside our listeners.
Well said.
Thank you.
So, as we wrap up this insightful look at the information from Life by Dr. Pat,
Okay.
is there one thought-provoking question you'd like to leave our listeners with? Something they can ponder as they continue their own exploration of this fascinating topic?
Given the potential benefits and limitations we've discussed,
Yeah.
how might the wider adoption of 3D TVUS change the landscape of infertility diagnosis and treatment?
Wow.
How could it impact patient experiences, medical practices, and even societal perceptions of infertility?
That's a fantastic question.
Thank you.
It really encourages us to think beyond the technical aspects of the technology and consider its broader implications.
Exactly.
It's definitely something to reflect on, research further, and discuss as 3D TVUS continues to evolve within the world of fertility.
Absolutely.
And with that, let's move on to the final part of our deep dive. We'll wrap up our exploration of 3D TVUS and its potential impact on the future of infertility care.
Yeah, it really is fascinating to think about, how advancements like 3D TVUS might, reshape this whole field of infertility care.
Yeah.
As we wrap up this deep dive, what are your final thoughts? Like for our listeners,
What should they take away from all this?
I think the key takeaway here is that 3D TVUS presents itself as a promising, less invasive alternative for those initial infertility evaluations.
Right.
But as we've discussed, it's still an evolving technology.
Right. And as with any new technology, there's still a lot of unanswered questions.
Exactly. Wider adoption will depend on factors like cost, accessibility training for healthcare providers,
Of course.
and of course, further research to solidify its effectiveness.
And it's important to remember that every individual's fertility journey is unique.
Absolutely.
What might be a suitable option for one person might not be the best fit for another.
Exactly. That's why it's so crucial for individuals to consult with their healthcare providers.
Right.
Discuss their specific circumstances and make informed decisions that align with their personal needs and goals.
So while this deep dive into 3D TVUS has given us a lot to think about,
Yeah.
it's essential for our listeners to continue their own research and seek personalized guidance from medical professionals.
I completely agree.
Yeah.
Knowledge is empowering,
Yes.
but it's most powerful when it's combined with expert advice tailored to your individual circumstances.
Well said.
Thank you.
So as we wrap up today's exploration of 3D TVUS,
Okay.
one final question for our listeners to ponder.
Okay.
Given the potential benefits and limitations we've discussed, imagine a future where 3D TVUS becomes widely adopted.
Okay.
How do you think that might change the landscape of infertility diagnosis and treatment?
Wow.
What new possibilities might emerge?
Yeah.
What challenges might arise?
Those are great questions to contemplate.
Yeah.
And they remind us that the conversation about 3D TVUS and its role in fertility care is just beginning.
Yeah.
As research advances
Right.
and the technology evolves,
Yeah.
we'll undoubtedly see new developments and a deeper understanding of its true potential.
It's an exciting time to be following these developments. And I encourage our listeners to stay curious, keep learning, and join us again for another deep dive into a fascinating topic.
Awesome.
Until next time, happy exploring.
Leading. Innovation. Fertility. Excellence. Life by Dr. Pat. Leading innovation in fertility excellence.